Assalamu alaikum. This presentation is about two similar, almost sister, continuous suture patterns that are similar in almost every aspect. They are useful in certain situations. There is a single difference in between these two suture patterns that makes one of them more employable in situations where you expect tension on the wound more than the other. In general, continuous suture patterns are formed up of repeated units of stitching that can either run perpendicular to the wound edge or run parallel to the wound edge. They are connected in that there are no ties in between these repeated units, except at the very beginning where you anchor the suture line and at the very end when you finalize it. In today's presentation, we go through the simple continuous pattern and the locked continuous patterns. These two patterns are very similar in that the anchoring stitch, the first stitch runs horizontally, perpendicular to the wound edge in this example, between 1 and 2, and this is where you form your first knot, and ends in a similar way perpendicular to the wound edge again when you finalize. In between, they go diagonally across the wound edge. So these are the three elements of the two patterns. They differ in one aspect. In the simple pattern, you avoid passing the needle through the loops of each unit of stitching, whereas in the locked you pass it through the loop to lock the suture line. The simple continuous pattern, as the name implies, is the simplest form of the continuous suture patterns. It's useful in saving time and it also saves of the suture materials. But more importantly, it distributes the tension across the whole wound evenly along the whole of the suture line. It has issues. If you lose a part of the suture line or one of the two knots, then you risk losing the whole of the suture line. The other thing is that it is difficult to gain accurate edge-to-edge opposition with this technique. That's why it's usually used for fascia and subcutaneous tissue rather than skin. This is to demonstrate the three main elements of the continuous suture pattern here. The first of the elements is the anchoring stitch, and this is a simple suture here going from one side to the other perpendicular to the wound edge and tying the first of the two knots required for this pattern. And once you secure your first knot, you move from the first level to the second diagonally across the wound edge. You go from here to there. And now you retrieve the needle in here across the wound edge, and if you retrieve the needle through the loop of suture like in here, then you get the locked suture pattern rather than the simple. If you want it as simple as possible, you avoid doing this and have the loop of the suture going across the wound diagonally. And then you move to the next level, and again a simple suture. And if you push the needle, then you can catch it in an area where you can actually just go on doing your sutures without reloading in between the steps. You just keep turning the needle from one level to the other. Now when you want to finalize this, you do your last finalizing stitch across the wound edge, again perpendicular to it, but you leave a loop of the suture so that you can tie on. So you have your last final stitch going across the wound edge and it's here that you want to tie your final knot. So the sister pattern to the simple continuous is the locked continuous, which offers greater stability of the suture line in the event of partial failure because of locking the suture between one level and the other. So it can withstand a little bit more tension than the simple suture pattern, but it consumes more of the suture material, and it's slightly more difficult to remove if you use the locked continuous sutures on the skin. The lock stitch has different other names like the Ford interlocking suture or the blanket sutures. It starts in the same way like the simple continuous suture, forming the first anchoring stitch across the wound edge where you tie your first knot, and then you move to the second level and you just retrieve the needle here through the loop of the sutures, and this will lock the suture line. And this simple trick allows this pattern to tolerate a little bit more tension if there is any partial failure in part of the suture line. Now, when you end this suture line, you just again do the same simple stitch across the wound edge perpendicular to it and tie on the loop of the tissue, and just bring the knot to one side again, and this will be the suture pattern that can withstand a little bit more tension than the simple suture pattern. And these two patterns, they start in the same way, having the anchoring stitch across the wound perpendicular to the wound before you move on diagonally, and also ends in the same way, simple stitch across the wound edge perpendicular to it, and then you tie on the previous loop somewhere here after passing the needle through the loop if you are anchoring it, or outside the loop if you are not, and this will bring about the second and the final knot of the suture line. By this we come to the end of this short presentation on the simple and the anchored type of continuous sutures. Assalamu alaikum.